Olson. I'm the Director of Rehab Services at MountainView Hospital. During the month of February, we celebrate Heart Health Month. Understanding that cardiac health is important and cardiac disease is one of the leading causes of death makes it that much more important understanding how to prevent heart disease. Though there are some inherent risk factors that we all have, there are certain modifiable factors that we can take upon ourselves to improve our chances of not being the victim of a cardiovascular event. Some of the easiest ways to prevent heart disease is just to simply stay active. If exercising in the traditional way of going to the gym is not your style, it may be as simple as just taking your dog for a walk, or doing some yard work, or even taking a brisk walk during your lunch break, taking the stairs to and from your office. There's a lot of different ways that you can just keep your heart active and prevent cardiovascular disease. However you choose to get active, the best thing to do is to choose something that you enjoy doing. That will make sure that you maintain that commitment to keep your heart active and healthy. The American Heart Association does recommend that you start by getting at least 150 minutes of moderate intensity activity throughout the week. That could be as simple as doing 20 minutes throughout the week, every day, or doing 60 minutes 3 days a week. It really depends on you and what you feel you'll be able to commit to being active. Another important factor that can help you keep your heart healthy would be to maintain a balanced diet. Though a conversation with your physician or a registered dietitian would do you well, some of the things you can start doing now would be to avoid processed carbohydrates, look for foods that have the good fats that can be found in nuts, oils, avocados, and to avoid those processed carbohydrates. Lastly, and possibly the most important factor you can do to keep your heart healthy, is stop smoking. Some positive changes will occur when you stop smoking. Most importantly, your risk for having a cardiovascular event goes down by 50% within the first year, and that will just continue to improve the further you get from smoking. During this month, let's all take the time needed to put a plan in place for each of us to improve our health, especially things that will keep our heart pumping smoothly for years to come. A good place to help you make that plan is to visit heart.org, the official site of the American Heart Association, where there is a library of helpful resources to help make that change.